Good morning, everyone. My name is Dr. Men. I am the medical director of the Richards Clinic, the chronic pain specialist. Today, I decided to do this week's lecture in audio format. October is a very wonderful month for us because every 12th of October, the whole world celebrates World Arthritis Day. And I wish to talk generally about arthritis. I know many of you have been following us in our weekly lectures, and today you are going to hear our lecture for the first time in audio format. And I wish to touch most of the things we have done before and to lay more emphasis on certain issues, especially on this terrible disease called arthritis. It's something many have continued to wonder what kind of disease is this and what is this. Due to misunderstanding and how chronic this disease is, some people have even considered that it's a diabolic attack. But arthritis is a medical condition. It is a disease and should not be confused as a natural consequence of aging. It can affect anyone. It can affect any joint. It's not just the knee, the elbow, or the hip. Arthritis occurs in the neck, low back, and every other movable joint in the body. What causes this disease? Actually, there's no singular known cause, but we have what we call factors. There are factors that predisposes a person to arthritis. We know it is commoner as one ages, yes. When we age, the body is not as strong and easily recoverable as when we are younger. But in as much as it's common in elderly people, it occurs in children. It is also known to be commoner in women. Other disposing factors could be any infection in the joint, trauma to a joint, excessive stress or pressure on a joint that can come due to people's certain occupations. Those that sit for a long time in their offices, most of them develop low back pain. Those that carry heavy loads, those that stand there a lot of time. So the occupation can also be a factor. Hormonal influences as well. We know that in women, estrogen protects them from certain diseases. So when one gets to menopause, it can also, most of these hormones will begin to reduce in quantity, and certain diseases like arthritis can start coming up, and a whole lot of factors. The question is, who does it affect? As I said earlier on, it can affect anyone, male, female, child, adult. Therefore, it's a disease that can affect anyone, any person. Now, what is really arthritis in specific terms? This is important to understand because in my years of experience treating people with chronic joint pain, I have come to the conclusion that people suffer arthritis for years, not because they didn't try to treat it, they didn't make efforts, but because all the efforts they made were in the wrong direction. They were actually treating the wrong thing, expecting the right results, which does not happen. Now, the common symptom of arthritis is pain. So what worries the patient more or first is pain. So it presents first with pain, and unfortunately, this is what people pursue. Treatments to take care of the pain, while the arthritis is behind the pain causing the havoc. Yes, at the beginning of arthritis, the major problem in the joint is what we call inflammation. And inflammation is what causes pain. But after about 3 months or so, degeneration begins to manifest. And as time goes on, degeneration overtakes inflammation. So there is degeneration, there is inflammation, and two of them are in vicious cycle, one feeding the other. Most of the treatments we know about are majorly for inflammation, but degeneration is actually the arthritis. What is degeneration? Degeneration is when the structures of the joints, like the ligaments, the cartilages, all the structures of the joints, begin to wear and tear. They begin to progressively destroy. It's just like when you have a plastic and you pour an acid, a little acid at a point, and you continue to pour more, it will be eaten into that plastic. So arthritis is actually destroyer of joint. So when those destruction is going on, it manifests as pain, as a way of informing the body or warning the body that a destructive process is going on in the joint. So most of the things we know about treatment is actually based on pain. Most of the things people do is actually to treat the pain while the destruction progresses from the ligaments to the cartilage and from the cartilage to the bone. And by the time it gets to the bone, deformity of the joints begins to take place. Like in the knee, you see somebody, because of arthritis, develops scale leg or bow leg. Therefore, to treat arthritis, degeneration has to be treated. Is it possible to treat degeneration? Luckily, we thank research and science. Because at a point, many people have even believed that arthritis has no cure. This was the time when all the treatments we knew were just painkiller, exercise your joint, or rest your joint, what we call generally as conservative treatment. But when it was realized that the joint structures can be regenerated, solution to arthritis is here with us. And that is what we call regenerative therapy. In regenerative therapy, we have prolotherapy, we have PRP, which stands for platelet-rich plasma therapy, we have prolozone, we have human stem cell therapy. These treatment options work at the root of the problem. They heal the damage. They regenerate, rebuild, heal, repair the damaged ligaments, cartilages, and even bone. Therefore, if we are talking about healing, it now makes sense to understand that when the damage is little, it can easily be repaired, isn't it? It makes sense, isn't it? But when the damage is much, it takes longer time and might not be completely repaired. Therefore, we cannot overemphasize the importance of using regenerative therapy as early as possible in the disease. The painful thing is most people wait until nothing else works. They now come for regenerative therapy. Before the advent of the discovery of regenerative therapy, at this point of severe degeneration, most people will be recommended surgery. But with the regenerative therapy, 99% of people might no longer need surgery. So as the world celebrates World Arthritis Day, this is actually a good news for those of us who do not know about it. That disease causing chronic pain, agony, and difficulty now has a solution. And the solution is natural and simple and direct to the joint, healing the joints and restoring the joints to normal. My name is Dr. May, a chronic pain specialist.